Good morning everyone and welcome to today's WorkSafe Tasmania month webinar, Fatigue Management, Safety, Health and Wellbeing. I'm Stephanie from WorkSafe Tasmania and also the coordinator of WorkSafe Tasmania month. I'll also be your moderator for this morning's presentation. Before we do get started though, I'd appreciate you taking a few moments to read the following slide about information delivered during WorkSafe month sessions. I'd now like to go over a few items so that you know how to participate in today's webinar. So we've taken a screenshot of an example of the attendee interface. So you should see something that looks like this on your computer screen in the upper right corner. You're most likely listening in using your computer's speaker system by default. However, if you would prefer to join by phone, please just select the telephone in the audio pane and the dial-in information will be displayed. You will also have the opportunity to submit text questions to today's presenter. You can submit those questions throughout today's presentation by typing your questions into the questions pane of the control panel. We'll also collect these questions, as I said, address them during the presentation and also at the end. We are also recording webinars during WorkSafe Tasmania month and will progressively make them available on the WorkSafe Tasmania site at the end of WorkSafe month. And lastly, before you do leave today's webinar, or at the end of when you do leave today's webinar, you will receive a survey on the presentation. So we certainly would appreciate you taking a few moments to provide us with your feedback about today's presentation and also about your webinar experience. So it is now my pleasure to introduce today's presenter, Oliver Fearman from IPM Safety, to present this morning's webinar, Fatigue Management, Safety, Health and Wellbeing. Welcome, Oliver.
Thank you, Stephanie. Good morning, everyone, and thank you for joining us on this Friday morning to have a chat about fatigue management. As Stephanie said, my name is Oliver Fearman. I'm a workplace health and safety consultant with IPM Safety. I've been involved in workplace health and safety for just on 10 years now. Initially getting into the field through involvement in a supervisory role in forest industries, harvesting tree seed. And initially safety sat as a little folder on the side of my desk, and then on one particular day I'm out harvesting tree seed and it's quite windy. I grab hold of a tree. My colleague Sean, who was in the basket with me 130 foot in the air, taps me on the shoulder and goes, "Ollie, let it go, let it go." Turn around, look over my shoulder, and the base of the platform 130 feet below us is moving, which not something you want to see at that height. Regardless, obviously that was it. Came down out of the trees, went, "This is not good." Sat down, had a bit of a chat with Sean about how we had not been managing our health and safety particularly well, and moved into the space of focusing on managing risk, and now that is very much what I do for my profession. And today, within that, we will be looking at fatigue management as a subject, and this is a particularly challenging subject given while it's very well studied. There's a variety of studies in it with a particularly big focus in the road safety space around driver safety, etc., and the impacts of fatigue. There are also studies, as I observed recently, that are focused entirely on just trying to figure out what is fatigue and define it. And interestingly, the study I was looking at the other day in that relation essentially came out with the end result of good question, which doesn't help us very much in terms of addressing it. However, it does give us an indication of just how complex this is as a topic. That said, for today's presentation, sorry guys, my technical skills have sent us in the wrong direction there. We'll go again. This is the definition we will be using for fatigue. And this is from the Safe Work Australia Guide for Managing the Risk of Fatigue at Work. You can find this on the Safe Work Australia website. It's listed with all of the codes of practice, which you can also find there. And essentially, fatigue in a work context is a state of mental and or physical exhaustion that reduces a person's ability to perform their work effectively. And it's important to note also that fatigue is usually considered to have two presentations. One is acute fatigue, and what we're looking at there is fatigue that's experienced after a one-off or immediate episode of sleep loss. So, for example, Sunday morning when those who attend the WorkSafe dinner that we will be having on Saturday night wake up, they may be experiencing some acute fatigue. On the other hand, there is also cumulative fatigue, which is where we have an extended period of loss of sleep, distraction, etc., that leads to, often people use the term sleep debt. When we're talking about a sleep debt, that's one of the effects of cumulative fatigue. So with that in mind, we will now go to our first poll question for today, which is, have you ever experienced fatigue? Stephanie will be able to explain to you how to run this one.
Okay, so the poll has shown up on your screens, everyone. So if you want to select either yes or no in terms of have you ever experienced fatigue. And I'll close the poll in a few seconds.
There we go. 95% have. Not surprising. The reality of it is that the vast majority of people within the workplace have at some point during their career, their life, etc., experienced fatigue. And while it's hard to define exactly what fatigue is in some cases, we all have felt it and can relate to that. So that while a very simple question was focused very much at just helping us see the frequency of fatigue. So what are some common causes of fatigue? Sorry, you're going to excuse me for a moment here. Sorry about that. I hope that didn't come too loud through the microphone. So work-related fatigue can have a number of causes. I've put some notes there on that slide, but I will also be discussing in further detail here, so please take notes if you feel the need. Things such as the time of day that the work takes place, as well as the length of the shift, has a massive impact. So where we're working in night shift environments, etc., automatically through working in a period that is not consistent with our biology's understanding of when we would be awake, impacts on how fatigued we are. And I'm sure that those of you listening who have done night shift work relate to that one automatically. The length of time spent at work and in work-related duties also strongly influences the levels of fatigue that people experience. Work design, so the type and duration of a work task and the environment in which it is performed. Is that task monotonous? Does it have highly demanding workloads? Is it mentally challenging work? And a simple example of this would be something along the lines of driving. I imagine many of you drove today to get to where you are seated now, and in doing so, on that drive you would have made a large number of choices about how to get to your end destination. You would have influenced the environment you were in through the noise that you may have in your vehicle, the temperature, the glare of the road, depending on the directions you were traveling. All of these factors heavily influence just how fatigued we become. And in the space of a 10-minute drive, that may have a very limited influence on our fatigue. However, then when we travel 2, 3 hours, 4 hours, whatever it may be, the longer that we expose ourselves to that environment, the greater fatigue build-up we have as a result of it. Obviously, inadequate recovery time between shifts and blocks of shifts is tied into that as well, in terms of giving people adequate opportunity to sleep. Organisational factors such as stressful work environments, bullying, harassment, other psychological factors. Stress is known to be very directly linked with fatigue levels, and factors that increase the stress levels people experience in their workplace will automatically increase the level of fatigue they experience. Another factor to consider is unplanned work, so overtime, emergencies, breakdowns, call-outs, where suddenly we're expected to jump into gear. Changing automatically your state can influence strongly your level of fatigue, and adding additional work onto your existing work requirements can also be a factor in that. Then there's features of the work environment, as we touched on before with the driving example, things like noise, temperatures, glare, dust, climate and environmental conditions. These can all strongly influence the amount of fatigue that people experience within their workplace. Next poll question. Is work the only cause of fatigue within your life?
So again, everyone, a poll has just shown up on your screen. So if you want to respond to either yes or no to the question, is work the only cause of fatigue in your life? So I'm now closing the poll, Oliver, and I'll share the results.
Again, not surprising that we have a majority of people indicating that work is not the only cause of fatigue in their life. Fantastic for the people that is the case. Congratulations. For those that don't have stress from work, sorry, just to clarify that. So that another simple question, but again with a strong point to that, which is, as well as the fact that we all experience fatigue, it's not just within our workplace that fatigue can be increased or influenced. And going to our next slide, we can see here a little photo off to the side, which is, while also a source of much joy in my life, definitely through the first 3 months of his life, a substantial influence on the fatigue levels I had personally. That's my son Milton there, and his sleep habits when he entered this world strongly influenced mine and my levels of fatigue relating to work. And these are the things that both as employers and people within a workplace we need to understand about each other when we're trying to manage fatigue. We have other contributing factors outside of work. So we've got sleep disruptions due to issues at home and non-work related factors. Some people have more than one job or strenuous recreational activities that can also strongly influence how fatigued they are when they arrive in the workplace. And then there are also, unfortunately, sleep disorders and other diseases that can strongly influence just how fatigued a person is when they arrive in the workplace. And we can add to that things like the use of alcohol, prescription medication, illegal drugs, and stresses associated with some of the other influences outside of life. And just at this point, I'll share an example from my own experiences of how this can influence things. In a previous job of mine, one of my colleagues that I work with, I'd only worked with him a little while, and I arrived at the work site one day and observed that he was not his usual bubbly self at the start of the day. He was drinking substantial amounts of coffee just to get into gear, and rubbing eyes, and a lot of the symptoms that we see relating to fatigue. So I inquired as to if everything was okay, and in our particular role at the time we were FIFO, so we were, in his case, he was 2 fairly long flights away from his family. And through discussion, he explained to me that his daughter, who was 4 years old at the time, was particularly unwell and in hospital. And he felt that this was a factor from outside of work, and as such he couldn't change things happening at work and needed to be there to continue doing his job. However, through discussion we came to the realization that he wasn't successfully performing his role. He was fatigued and distracted, which are not consistent with being able to perform safely in the workplace. So we looked at ways to address that and got him home to his family where he needed to be at the time. Now, that's quite an extreme example. However, the reality is that quite often we will have people within our workplace that are fatigued, and as a team we need to be able to identify and support each other in this. So, as touched on briefly, some of the signs of fatigue are things such as tiredness, even after sleep. So we get up in the morning, with the first couple of hours we may be a little groggy, we add some coffee and it doesn't change. There's actually an indication that we are fatigued. Psychological disturbances, people are a bit crankier than they might ordinarily be, or they're a bit spaced out. That can be due to fatigue. A loss of energy, irritability, moodiness, and inability to concentrate. And another factor that isn't listed there but is often used to identify fatigue in the workplace is poor hand-eye coordination. So we can observe people and tell that they're not up to their usual capacity in terms of performing tasks. And other symptoms can be frequent yawning, rubbing of eyes, things like that that are commonly known to be indicators of fatigue. So what are the risks associated with fatigue? Quite clearly, where people are not to their full mental capacity, their alertness, their decision to make judgments and choices. We've all been in a vehicle at some point in our lives where we've been on a particularly long drive. We've got out of it at the end of the drive and gone, how did I get here? Now, at some point during that drive, we were more than likely fatigued. And where we weren't able to determine exactly how we got to the location, how do we then have confidence in the choices we've made during that process? So being fatigued can strongly influence that, and response times have been, through a number of the studies conducted, been shown to dramatically decrease as a result of fatigue. Also long-term health problems, so things like chronic fatigue syndrome obviously is a very current example of that. And stress has been proven to deliver a number of symptoms and health challenges for individuals. I was recently talking to someone who works in the field of treating what he says is majority stress-related injuries as a masseuse. So it's a lot of muscular challenges, etc., that people are experiencing through tension, fatigue, and so forth. And these manifest themselves in a number of different ways within each individual, depending on their biology. So what have we covered so far? We're aware of the fact that fatigue is a very diverse and challenging topic. It's well studied, and we know that it has an immediate impact on our ability to successfully complete our jobs and the potential of incidents within our workplace. And it's also a bit like I am for you guys at the moment, in terms of you've got some evidence through my voice that I exist, and we've all said we've experienced fatigue in our lives. However, it's not always easy to see. Like at the moment, you can't see me, but you know that I'm here. So how do we take on something that's so challenging is the next space that we'll move into. But before we do that, I'm going to test a little exercise with you all that hopefully works well. I'm getting with the webinar thing, trying to engage you with a challenging thing, but we're going to work here. So if everyone can please bear with me, what I'm going to do to start off with is, if you can all stand up and just stretch your legs, shake your arms out a little bit, and just move essentially for a moment. Now return to your seat, sit down, arms by your side, and I want you to, facing up, chest clear, breathe in deeply through your nose and out through your mouth. Just let it out. And interestingly, breathing exercises such as this and mindfulness, which we'll go into just briefly here, have been proven to help manage stress and reduce fatigue levels for for people within the workplace. Now, what I'm going to get you to do now is, we're on a Friday, we're about to have a beautiful weekend. So as we're breathing in through the nose and out through the mouth and just relaxing a bit, I want you to close your eyes and think of the thing you are most looking forward to this weekend. Now, that may be getting out on a fishing boat, it might be some work in the garden, time on the beach, just enjoying the beautiful Tassie spring. Now, breathing, relaxing, I want you to have a look around what would be with you in that moment, whether it's family and friends, just the serenity of the lovely Tassie environment. And now, that brings me to the next point around why we manage fatigue. For me, there's some images on the screen right now. This is what I look forward to on the weekend. This is my wife, my son, activities outside, enjoying the world out there and participating. And this is very much why we need to manage risk. And if we can come from this place around managing fatigue within our workplace, we have a really good opportunity to succeed. This is the easiest topic to talk about. I'm sure that for those of you who were comfortable with closing your eyes and having a little bit of a thought about what your weekend involved, you saw some things there that are worth taking care of yourself and each other for. So thank you for doing that. And now to move into the space of what are some of the challenges that we see in managing fatigue in the workplace. So that there's common misconceptions that we have within managing risk for fatigue, in that roster systems will be able to manage it. And that's absolutely a part of it. We do need to be very careful about how we roster our teams and the number of hours that we have people at work, and the amount of opportunity we give them to achieve adequate rest in response to the time they've been at work. However, as we've touched on earlier, and as 90% of you identified, there are things that happen outside of our work that also influence our fatigue. And as employers, we obviously can't step out into people's personal lives and say, you know, tomorrow you have to be ready for work, so please don't do the things you enjoy, just focus on getting back to work. However, we do need to be mindful of this, and we do need to understand that a roster is not going to be able to manage that. And at the same time, believing that fatigue is up to the individual to manage leaves us in a much less error-tolerant environment than if we look at it as a team and how we can support each other to manage that. So how do we do that is the question. Firstly, we need to assess the risk that exists within your business operations around fatigue. So where is fatigue likely to be a factor? What tasks does your workplace have that involves fatigue? Where are there the potential to monotonous tasks with a lot of glare, where people are going to be straining with their eyes or moving in and out of bright and dark environments? Things like this influence how fatigued people will become and their capacity through the course of the day to complete that task. So it's about where we're conducting a JSA, where we're doing a risk assessment, where we're writing up a SWIMS, that we factor in fatigue. We identify, okay, can this task contribute to someone's fatigue levels? What things prior to this task may also contribute to that? And we need to look at that from not just a task related, but a business wide perspective to be able to identify this. And that's where developing a fatigue risk management plan, which is something that we assist workplaces with as an organisation, and really delivers a lot of value for those workplaces, is being able to, as a team, identify where fatigue is presenting a challenge to our people getting home safe and well, and then determining the sort of controls that we can use to do that. And one of those controls relates very much to that next dot point, which is about building a culture that supports and enables safe choices. And some of you may have heard the safety culture presentation at the start of the WorkSafe presentations a couple of weeks ago, in which we talked about how we build a positive safety culture. And one of the key things there is simplifying health and safety, so making simple processes that people can use to identify and manage these things, tools to discuss with each other, making it personal, like the little exercise we did a moment ago where I wanted you to focus on, for you, your personal reasons for wanting to manage this, because this really helps us to come to agreement in terms of why we want to get home safely. And then really crucial in the space of fatigue is making it safe to speak up. So it's really important that where fatigue is an issue in our workplace, where we know that people will at times be attending our workplace fatigue, that they also feel comfortable and able to speak to the team that they work with and say, hey guys, look, at the moment I'm particularly fatigued, whether it's like for myself in February, my second child arrives and my team already knows that in February there is a very high probability of me coming to work fatigued a few times. And I'll definitely be talking to that with them. It's essential for us to be able to manage these things. We need to be able to communicate it. The information needs to get to the right people. There's been a lot of research done within the workplace health and safety environment to determine some of the factors that contribute to not effectively managing risk. And one of those is communication and ensuring that information gets to the appropriate people. Because while I know I'm fatigued when I arrive at work, having had experiences at home or having had a few big days, maybe there are other members of my team that also know it, but I need to share it with them and ensure that it gets to the people who can also assist me with that. So then through the leadership, etc., my team can support me. And part of it is measuring and benchmarking too. So what is our culture presently? Can we support people to manage fatigue? Have we been good at this? And how are we traveling so that we know what we need to improve, where our strengths are, where we need to focus. Raising reporting levels is also a massive influence on managing fatigue. So like I said before, making it safe to speak up, but also having processes whereby we can report these things. If we can monitor how we're doing, how frequently, have we got areas where people are continuously coming to work fatigued, because that may be as a result of our activities, it may be other factors. However, without being able to identify it and know that it exists and measure it, it's very hard to know how we appropriately respond. And closing the loop too. So if we get into an environment where people are able to speak up and share with us challenges that they're having in relation to fatigue, responding to that and demonstrating that sharing has been taken on board is valued, and we will support them. Visible leadership. I had a previous job where the most fatigued person consistently in the workplace was our supervisor, and he was an incredibly hard-working individual, and we all appreciated how he went about things, aside from the fact that he also routinely came to work exhausted, and it leaves us concerned as to whether that is the standard and the expectation around how we deal with fatigue in our workplace, which is something we need to be conscious of and manage. And interrupting the unsafe and unhealthy is also a big factor here. So you identify that someone is fatigued, like I talked about earlier, that example from my work environment. I needed to talk to that individual. He had something happening outside of work in his life that was making it hard for him to complete his job. He didn't feel it was appropriate to share it, and being able to interrupt that and assist him to identify that it was and it needed to be addressed is really important. And that, in short, is how we approach managing risk in the workplace for fatigue. Are there any questions, Steph? What have we got coming through?
Yes, no, thank you very much for your presentation, Oliver. Fatigue management, safety, health and wellbeing. So we will just go through a few questions that have already come through, and if anyone does want to submit any questions, there is still time, so please do type your questions in the question pane in the control panel on the upper right hand side. So one question that has come through, you talked about support, Oliver, so the question is, how do I support someone who is fatigued?
Very good question, Steph. So there are a number of ways that we can support fatigued persons within our workplace, and obviously that also depends on our role within the work environment. Quite frequently, workplaces have a number of tasks that are available to people, and where we've identified that someone is fatigued, being able to move that person into tasks that are more appropriate for someone that may not be at full capacity is certainly one aspect. Rotating the tasks. So, okay, mate, come over here and do this for a little while. But also checking in is a big one. So just saying, hey, how are you traveling? I know you're a little bit tired when you arrived today. Are you doing all right? Do you need a breather? Do you need to get up and move around? Supporting them to be active and still participate, and also monitoring whether they're capable of that and going to effectively do so is a good way of supporting, as long as we bring it from a genuine space of concern for them and not critical.
Okay, so two questions which are probably fairly similar in aspects. So the questions are there methods for testing fatigue? And the other question is, can you suggest any fatigue measurement tools?
Yes, so there are a large number of options in the space of measuring fatigue. To be honest, there's nothing that I would strongly recommend has been proven to work particularly well as a tool to measure fatigue. You can measure people's hand-eye coordination. There's more clinical versions of that. It depends a lot on the budget you have available as to how much you can invest into the testing process. I'd strongly encourage working on developing that culture where people are comfortable and safe to put their hand up and say, I'm fatigued. That's one of the strongest indicators. People are most capable of identifying their own fatigue, but also those who work directly with them. Identifying it is one of the strongest methods and most consistent methods for being able to adapt and address that. There are tools such as questionnaires and skill testers that can also be used with varying degrees of consistency. You really need a baseline established for many of those. For example, my hand-eye coordination can at times be incredibly clumsy, but that doesn't instantly mean that I'm fatigued. So being able to identify that there is a difference from standard capacity and what that difference is quite challenging.
Okay, thanks, Oliver. So a question or a comment has come in asking if you're able to just make any comment on back-to-back shifts or double shifts and consequences around, working in.
Yeah, absolutely. So quite clearly, where we're having double shifts, back-to-back shifts. Firstly, the space between the two, if there is a space between those two, is a significant factor. So how much time are we allowing as a break? And then what have we got either end of those shifts? Are we talking back to back, so it's two shifts close together and then a prolonged period of rest and relaxation? For example, my FIFO experiences in the past, one particular job, I had 6 weeks away working 7 days a week, 12 hours a day for 6 weeks straight. That then had a 2-week break on the back end of it where you were intended to recharge before you went back to it again. I had the same where it was 2 weeks break, 2 weeks at work. So there's many factors that can influence how effective we can perform back-to-back tasks. I would strongly encourage reducing the frequency of such shifts. However, a big part of that is risk assessment to identify all of the factors that can influence that. So what's happened in the lead up, what's happening at the end of, what is the demand relating to the tasks that it's back-to-back shifts of? Is it a high demand task? How high risk are the tasks being performed within this shift? And what level of capacity do we need from the individuals to be able to perform that safely?
Okay, just a follow-up question that's come in relation to the double shifts question. We hear lots of medical, nursing, paramedics, staff in hospitals are working multiple double shifts. Is this posing a fatigue risk in the industry?
Definitely does pose a fatigue risk, without a doubt. The reality is that anywhere where we have work demands on people, we have fatigue risks. So the minute anyone walks into a workplace and starts performing a task, there's risk that fatigue will influence their capacity to perform that task safely. I previously worked with a doctor, lived with a doctor, sorry, in a another country for a while, and the hours which he performed his work would not have been legal for someone who was driving a truck in Australia. Um, Now that's not to make a statement about whether or not that was appropriately managing the risk. However, the reality is that we need to very much be aware of the amount of work people are doing within the task, the significance of that. I mean, 90% of people performing caring tasks such as people in hospitals and looking after people's well-being are taking on some amazing responsibilities and performing some incredibly important work. So ensuring that they are adequately rested is really important, and having thorough systems to support that is an incredibly important aspect of that.
All right, thank you, Oliver. And just as a reminder, you can still submit questions through the questions pane in your attendee control panel. So another question that has come through: what activities can be done to ward off fatigue in an office environment where tasks are monotonous?
Step one, get up, take a break. Do it right now if that is the case, absolutely. Being active strongly influences, and breathing. So where we can take a moment to break that monotony, it delivers a great deal of value. That's not to say that we need to get up, go for a half-hour run. However, just breaking it, get up 5 minutes, walk around the office, go and do something else that needs to be done, come back again. That will strongly reduce the level of fatigue that you're experiencing from being stationary. We've also had a lot of studies about just being still in the workplace and sitting in the one location and how much influence that can have on people's well-being. So being able to get up and move around is a lot of value. For my mind, things like stretching, etc., are a great way to achieve that. So getting up, stretching some of the different muscles, maybe some squats, some exercises that are able to be performed safely within your workspace, but will get some blood flowing, get your mind working. The other thing we can do is some mental exercises, just to change it up. There's a number of apps you'll be able to find available to you that give you a few little mental challenges where work's been very monotonous and low demand for your mental capacity. That can often assist. I'd encourage doing that to a level that's not interfering with being effective at work, but there's a great deal of value in taking breaks and exercising both the mind and the body.
All right, thank you, Oliver. Another question that has come through: how do you get a manager to acknowledge a risk when it is pointed out by staff that a worker is fatigued? The manager needs, the manager needs the staff member to be working.
Uh, that's where we need to look at the work that the individual is doing. What are the demands of that work? Essentially, it's performing a risk assessment to some degree. So, okay, we've identified this person is fatigued, or we raised the concern. Now, if that's not immediately taken on board by the manager, my first port of call when I see that someone's fatigued in the workplace isn't straight to the manager, it's straight to the person who I'm concerned about. So going to them going, mate, I've noticed this, you seem fatigued today. How are you doing? Is there anything I can do to support you and assist you in managing this? Where it's identified that that's still a challenge, or that they may not get home safe today as a result of that fatigue, then definitely we need to go to the manager and go, look, this is the issue that's been identified, this is the person involved, what can we do? And then it's about identifying what tasks we have available. It's much like injury management within the workplace when we're managing someone that's fatigued. If we still need active contribution from that person, what can they do to contribute effectively that doesn't increase the level of risk to both themselves and the others that they share the workplace with? And then how do we assign that, and who can support them? That may be through giving them a buddy and through ensuring frequent breaks, etc. Or it may be through saying, sorry mate, but the level of fatigue that you're experiencing today is not consistent with you performing your job safely. We need you to go and take a rest.
All right, thanks, Oliver. So question, truck drivers drive long hours. How do they cope with fatigue?
So there's a number of systems within the transport industry for fatigue management that include logbooks, and there's varying levels of fatigue management that they use, from basic fatigue management through to advanced fatigue management, where they can set their own rostering. Um, I won't try and explain the whole process right now because that would be incredibly long. However, essentially, it's about identifying what's an appropriate time period for that person to work as a whole, logging it through the logbooks, monitoring conformance with the appropriate hours, and where we're having challenges with that, addressing it. So, okay, why, how, what are the consequences of this? And much the same as the methods we can use within other work environments.
All right, thanks, Oliver. So just a follow-on question then, is there, or what is an app for mental fatigue?
Oh, there's a challenge to give you an answer straight away. See, I was using one not that long ago, and my memory's unfortunately very similar to that of a goldfish. I would strongly encourage, if you go onto your app stores, etc., you could, through typing in the searches, you'll get a number of different brain quiz, brain exercise, etc. Apps. Not all of them will be fantastic, I must admit. However, all of them will have some value. If you would really like a specific example, if you could provide Steph with contact detail, I will this afternoon locate an example of that I have found to be effective. Oh, no, it's come to me. Luminosity. There you go. Sorry, folks. That is one that's great for brain exercise, and one that's used by a number of people in the work environments that I have worked in the past, for FIFO type roles where things can be very monotonous and getting to test the brain is desirable. So Luminosity, which is spelled Luminosity, I believe. I hope that's right.
All right, thanks, Oliver. Another question, is the feeling a little drowsy after lunch categorized as fatigue?
No, I wouldn't call that fatigue specifically. Some people may categorise that as fatigue. Some of you may be feeling almost fatigued, having sat still and listened to me for this period of time already, and I would say that the little drowsy after food and a bit of a break is a similar thing. It's the body's response to a feed and some sunshine quite often is to go, oh, let's just enjoy this for a moment, sit here under a tree. No, I wouldn't call that fatigue that's going to strongly influence your workplace. That said, if you felt that every time that you were having a break, there may be something stronger to that that's worth looking into.
All right, thanks, Oliver. And again, if anyone does want to submit any further questions to Oliver, please submit them or type them into the questions pane in your control panel. While any further questions are coming through, I'll just remind you that WorkSafe Tasmania month does finish next Friday on the 30th of October. So we are still running webinars next week. So if you haven't registered for any presentations, please do head to the WorkSafe Tasmania website. Either download a copy of the events program if you don't have a hard copy of your own, or head straight to the registration calendar and sign yourself up for any further activities that we do have running. We are also running venue events in Devonport on Monday and a couple in Smithton on Tuesday. So if you are in those areas, please do again have a look at the program and see what events we do have running on those 2 days. So question, Oliver, what are your thoughts on chronic fatigue syndrome do you know of any ways to deal with constant fatigue that won't go away?
Ooh. I'm always very cautious of talking about things that are probably more for the medical professionals. I have had some fatigue issues myself in the past. Um, One of those was attributed to a deficiency in vitamin D. At the time I was in an environment where I didn't get a substantial amount of sunshine. I did find that supplements for vitamin D did assist in that. Now that's my own personal experience of a very minor fatigue issue. Chronic fatigue is definitely something where my strongest advice is see a medical professional. If you're experiencing high levels of fatigue on a routine basis, that's really something where an expert in that the field of medical health needs to be assisting you, because there can be so many different factors that influence that, and getting assistance is essential. You don't want to be going through life feeling like that. That's a tough one. So definitely get help.
All right, thanks, Oliver. So a question has just come in relation to the Devonport sessions we're running on Monday, the 26th of October. They're happening at the Devonport Entertainment and Convention Centre from 10 a.m. So again, do have a look in your events program, or head to the WorkSafe Tasmania website to see what events we have running. So we've got 4 short seminars that we're running throughout the day from, as I said, from 10 a.m. up until 3:30, I think it is. So again, do have a look at the events program. And on that note, Oliver, I certainly do thank you very much for your presentation today. Fatigue management, safety, health and wellbeing. I also thank everyone for attending today's webinar. And as again, once you do leave today's presentation, you will receive a short survey, and we certainly appreciate you completing that and providing your feedback. But before I do close off, last question has come through, Oliver. Whoops. So if we go back, if fatigue is considered a recognised problem at work, for example, truck drivers, then can employees be held liable for this?
Employers, sorry.
Yes, yes, yes.
Um, it's a very challenging space in that regard. There's certainly the potential for that to occur. One of the challenges that's found within the space of identifying fatigue as a causal factor for incidents is being able to demonstrate something that, as we sort of touched on earlier in the presentation, is very hard to define clearly. Definitely where there's clear demonstration of poorly managing fatigue through rostering and other demands on the workforce, the potential for the consequences for employers are certainly there. I would say that the biggest focus point for all workplaces is, are we addressing fatigue? Have we got it on the radar, and how are we approaching it? And not being able to do so presently in the environment as it is under the new legislation, etc., it'd be very hard to say you are consistent with effectively managing risk if you're not identifying a factor such as that and working towards improving the ways that you manage it.
All right, thanks, Oliver. And again, thank you for being this morning's webinar presenter. And on behalf of WorkSafe Tasmania and our presenter today, Oliver Fearman from IPM Safety, thank you for joining us, and have a great, safe and healthy rest of the day. Thank you, Oliver.
Thank you.